So welcome to the October 31st edition of our Transformation Tuesdays. And happy Halloween, as we just said earlier. In the spirit of trick or treat, today we're going to discuss how we can stop scaring ourselves on the topic of nursing homes and long-term care, and try to sweeten the notion of looking after those who require care with open discussion and constructive actions. So most of you are familiar with our program format, but just let me give you a little background about the webinar. So the Gray Panthers launched the virtual Transformation Tuesdays monthly series in July of 2021 to offer a safe space for open discussion about the transformation of nursing homes and long-term care. From May through August this year, I had the privilege of hosting the Unity subset of Transformation Tuesdays with my co-chair, Carrie Leljadal, the family advocate extraordinaire. She's in Baltimore today at the Consumer Voice Conference, and maybe some of you are there with her. So last month, we shifted our focus to expressing gratitude to a group of deserving individuals who worked in facilities during the height of the pandemic. And we honored 13 people from around the nation. You can see more about them on our website and find out everything about their amazing dedication. A couple of years ago, in response to the pandemic, Jack, the president of Gray Panthers, and I produced a documentary that we called Honoring Nursing Home Lives Lost. The intention was to offer the bereaved the opportunity to express grief. As residents and staff perished in record numbers, the story grabbed headlines for long-term care. But as the vaccine came along, the focus on caring for the most vulnerable has faded from the front pages. Lately, however, just the other day, just in time for me to use it for this webinar, a local story popped up that grabbed some media, in the New York Times, in fact. A 64-year-old woman, Beverly Shaw, arrived in New York City with her emotional support goats, trying to raise money to hire an attorney and get her husband out of a nursing home where she believes he's being held against his will. And I wonder, is this the type of action that we need to keep this important topic front of mind? So let's hear what our expert panel of media pundits have to say about the issue. I'm excited to have 4 excellent presenters who come to this field from different angles. The program will begin with Meg Laporte, a writer and communications consultant in the elder care space who's passionate about leveraging storytelling and creativity to enact social change. She's the co-founder of Art Against Ageism. She will be followed by Rosemary Armao, visiting professor of journalism at SUNY Albany, host of the podcast on Armao on the Brink, long-term radio presence on Albany's NPR affiliate, and a regional editor of the Organized Crime and Corruption Reporting Project based in Bosnia. Then we'll hear from John Leland, Metro reporter at the New York Times, who's written extensively about older adults. The series he began in 2015 followed 6 people over the age of 85 and became the basis of his book, Happiness is a Choice You Make, Lessons from a Year Among the Oldest Old. And our program will close with veteran journalist Ron Rowell, who spent his career covering business, politics, and social issues, now focusing on a field he calls successful aging. He spent 20 years as a reporter and editor at Long Island's Newsday, where he helped found Act Two, a weekly section for readers over age 50. And now I'll hand the mic over to Meg Laporte. Meg?
Thank you very much. First, I want to thank Gray Panthers for recognizing the importance of bridging gaps and bringing people together to discuss important topics around elder care in this country. I might be an odd duck on this panel because I'm not a formal journalist, but I have spent the last 23 years of my work inside the field of aging services, mostly as a writer and a storyteller. For 9 of those years, I was managing editor of a trade magazine for and about the business of nursing homes and elder care. The job, which began in 2005, was for me revelatory. I had done freelance writing before that, but through this work, I was able to get to know amazing people who care for elders in these settings, from CNAs and nurses to administrators and social workers and owners and operators. I love telling their stories, and I learned a great deal from doing so. After I left the magazine and had by then obtained a graduate degree in management of aging services, I realized I wanted to continue telling stories, this time those of elders. So I started a blog called Age in America that was fashioned after Humans of New York. I created a list of questions and found my way into nursing homes, assisted living communities, senior centers, and more, where I asked people to tell me about their lives. And like Humans of New York, I took their photos and then posted their stories and images online. This, for me, was a way to leverage art and storytelling to change negative perceptions of older adults. Fast forward to 2020, and I was working for the Greenhouse Project, an organization that advances person-directed, small house, non-institutional models of long-term and post-acute care. My role was as director of communications. The pandemic was ravaging nursing homes and their residents across the country, but not in greenhouse homes. In greenhouse homes, there was much less incidence of COVID and much fewer deaths because of the model's small scale, easy access to the outdoors, and the fact that all residents had private rooms and their own bathrooms. Major news outlets got wind of this, and the coverage became near constant. Through no real effort of my own, I was fielding calls and emails from major outlets like the New York Times, the Washington Post, the Wall Street Journal, the Atlantic, Politico, TV networks, and many others. This was great coverage and great exposure for a model of care that should be the norm by now. And because of that coverage, today, the greenhouse model and others like it have gained traction as an elder care best practice, and it comes up consistently in conversations around nursing home transformation. This, in my opinion, serves as an example of how journalists, truth seekers, and media coverage can help to change the conversation for the better. And here's the thing. There is so much more to cover about nursing homes. The media covers the culture, reflects the culture, and helps to create the culture. This is a very powerful thing. And by turning its attention to settings where older adults are often walled off and othered, there can be light, and there is and can be positive change. Journalists, as well as editors, have the power to serve as watchdogs, holding nursing homes accountable for the care they provide. They play a pivotal role in shedding light on the conditions and treatment of elders in long-term care settings. And here's why it matters. On any given day, there are more than 1 million people living in nursing homes in this country, most of them over the age of 85, and most are very sick. Nursing homes are communities unto themselves, where the people who work there are dedicated to improving and ensuring the care and safety of those who live there. I have found 4 major topics, if you will, that deserve more attention from reporters and journalists and the outlets they work for. First, innovative models of person-directed care that work, such as the Greenhouse model, Eden Alternative, and others who have figured out how to put residents, people, at the center of operations and care. Second, systemic ageism, the reason why medicalized and institutionalized care was created. Media coverage can help to humanize older adults and provide a platform for their voices to be heard by dismantling stereotypes and fostering empathy, as well as encouraging audience to respect and honor elders as valued members of our society. Third, nursing home reform and transformation. Many individuals and entities have arisen in the aftermath of the pandemic, focused on how to transform and reform nursing homes for the better, such as Moving Forward, the Live Oak Project, and of course, Gray Panthers. They see the value in bridging gaps and bringing diverse opinions and stakeholders together. Fourth, the direct care workforce. Journalists also have the power to shed light on the incredible people who work in nursing homes, most especially direct care workers, who make up the largest contingent of the long-term care workforce and work closest to the residents, but are paid barely a living wage, thanks in part to Medicaid policies that appear to place little value on how much care older adults deserve. Under each of these categories, there are stories to tell and lessons to be learned, all deserving the disinfectant of sunlight. Journalism in its many forms can empower families to make informed decisions about the care of their loved ones and inspire change makers to enact necessary improvements, advocate for policy changes, increase funding, and improve standards of care. Journalists offer a beacon of hope and accountability for those of us who care so much for elders. My call to actions to media, to journalists, editors, podcasters, and other storytellers is to continue to be curious, continue to dig, and consider how your work can have a positive impact on those who are currently receiving care in nursing homes, but also on those who will need care in the future, such as you and your loved ones. Thank you, Michelle.
Thank you, Meg, for the call to action. Our next speaker is Rosemary Armao. So Rosemary, you have the floor.
I have to find the unmute button. I did that. So Meg, that was amazing. I wrote down those 4 areas, but here's the brutal truth. Just because something is important, just because it affects millions of people, all of us eventually, unless we die, doesn't mean it's newsworthy. And worse than that, even if it is newsworthy, you still are likely not to get coverage. And that's partly fewer journalists out there working. It's because there's lots of competition. Right now, for example, talk to climate change scientists. That might be the most important story in the planet, of the planet, and it's not getting enough coverage. Not getting a lot of coverage at all in the recent days because there's war in Gaza. So talk to the people who think that Ukraine war should be covered. Talk to the people affected over 20 years by the Afghan war. Journalists go after the shiniest new object. And so that's why I love the title of this presentation, because you were right. You had your shining moment during COVID. That was a great opportunity to talk about your topic. And that is what you have to do now, is find a way to get back in again with all this competition. We also compete with one another. In addition to the goat story that you mentioned, there's been a rash of stories lately about the sandwich generation, people who take care of their children at the same time that they're taking care of their parents. A1 has a podcast on that this week. My podcast talks about people taking care of their parents at home. By the way, I am living elder care. My mother's 98. I live with her. And she's usually in bed at this time with a nap, but she's up. So if you see me dart out of here, I'm not being rude. I'm just making sure she's okay. But that's the problem. There's just not enough people doing the work. We know it's important, but there's not enough of us, and there's too much competition for other things going on. So what I did was talk to a whole lot of friends who are both journalists and public relations people to see how they would get around this. And the example that I used for them was not even elder care. It was something that always bothered me. I'm old enough to remember when the first parents came into the newsroom and talked about how their little child needed an operation to save their life. And it was incredibly expensive. They couldn't pay for it. So they put on a barbecue and invited the public to come in. That was a front page story. Second set of parents who came in had a child similarly sick, different operation, different kind of fundraiser, was on an inside page. By the 5th or 6th parent, forget it. We're bored with it. It's like this passion overload. It's like, no, we already did that story. And that is the feeling. So how do you get around that? How do you get reporters, when there are fewer of them, when they're competing with others, when there are bigger stories, how do you get them to pay attention? And in some ways, if this sounds like public relations 101, which it might, I apologize. I welcome your questions later. I think the number one thing is, what is the message? What is it we want to say about long-term care? Is it, you had 4 areas, Meg, but what's the one thing? What are we really trying to say? When I read John, I love your series. I've always loved that series since it came out. It was like, old people are interesting. That was the message. It was like we were surprised by it. What do we want to say about long-term care? We have to be able to answer that question. And the second one is, who is it we're pitching these stories to? Is it people who are about to go into long-term care themselves and maybe afraid of it? Is it their children? who are pushing them or paying for them or resisting it. Who are we pitching these stories to? I think that's another deficit, a difficulty that you have, is that most media outlets are going after young people. I never understood that. We're the ones that have the numbers, the boomers have the numbers, we've got the money, but what advertisers and media outlets generally want are young audience. So how do you appeal to young people writing about something mostly they're afraid of? I think we have to remember that stories are about people. They are not about facilities. They're not about statistics. They're not about trends. They're not about insurance or government healthcare programs or models that work. Sorry, Meg, but that's the kind of language that, as a journalist, I hear that and I'm yawning. I don't want to hear about that. I want to hear about the staff and the patients or clients, whatever they're being called. I want to hear about the families of those people. And if you can't tell the stories from that point of view, you're not going to get any traction in the media. It is up to us, people who care about these stories, to create content that will attract media attention. They have to have pathos. We have too much of that, maybe, but pathos works. That's why COVID was such a push. People dying alone. Oh my God, it doesn't get worse than that. Or stories of triumph. John, you, I think, are an expert in that. Stories that surprise us. Original research, which, Meg, that's what you're talking about. Models that work. It's research. Hey, here's a way to get old and it's kind of cool. It's got to be phrased that way. Experts who can explain things to us, and anything with infographics or video or all the technology. We have to go to the media with these things. And there's a lot of grunt work in getting your story out to the media, just plain old grunt work. You have to have a list of experts. If I call you with the question, I expect you to tell me, oh, you need to talk to so-and-so about this. They have great information. You have to have a list of media and reporters who are sympathetic to this. You want Rosemary Armayo, Meg Laporte, Ron Rowell, John Leland. You want us on your media list because we're going to listen to you. If you send a note to the New York Times or to the Berkshire Eagle and say, this is an important story and we hope you'll cover it, pay attention, forget about it. That just is very ineffective. You have to have a media plan. That's why I said, what is the message? Who do you want to reach? What does success look like? How many newspapers, how many stories have to appear before you think, wow, we really did this right? And you have to make it super easy. You have to hand feed reporters. There's no other way to say it than that, but bluntly. If I'm going to need photos or video with every story I do. So I want you to get the releases done. Don't make me go hunting for people who say it's okay for me to take their picture. That's your job. It really isn't. It's mine, but I'll tell you, you do that job, and you're going to get better play. Target freelancers too. Remember when I said go after reporters? Don't just stick with newspapers, TV stations. What we really need is the creation of an aging beat. When I was 24 years old, the first job I had in newspapers was at the Albany Knickerbocker News. Doesn't even exist now. 24 years old, and I was given a beat about aging. And every week I came up with a great story because that was my column. It was my space. I found the stories. You're seeing it right now with Gannett, who's looking for a Taylor Swift reporter. And that's because every week there is going to be a Taylor Swift story and it will get readers. And that's how you create news. It's you have a reporter who goes after him. Your strategy would advance the story. Like, you can't tell the same story. Nursing homes have to reform. You have to tell a story 1 week about, here's a nursing home doing things completely different. Here's one that failed and everybody's turned out on the street. What about nursing homes in Gaza right now? Try to connect to war, for example. What about nursing homes in Ukraine? What's happening to old people there? You can think global, but place your story. You're not going to get the New York Times or the Wall Street Journal to write 10 great front page stories for you, but you might get one in the Berkshire Eagle, and one in the Albany Times Union, and one on a radio station in San Diego. You have a plan and you cover all the fronts. You have to be, as I put it, think like a propagandist, because this propaganda we're spreading. This is an important story. We want you to see it. So think like one. I think you should come up with a story list. Meg, you just did that. That was a really good illustration. Here's 4 areas you should be looking at right away. But you can do more than that. Christmas is coming up. Papers have a and TV too have a terrible time on holidays. They have fewer staff than ever and no stories, and they have a quota of good feel good stories. You can plan those in nursing homes or people who are taking care of the elderly at home too. Birthday parties. For people who turn 100 or 101, those are becoming almost routine now. What's a different way we can tell that story? Everyone says the advice that you get for caring for the elderly, it just sucks so bad. It's so generic. It's like, oh, they may be afraid of water and you'll have trouble with hygiene. That does not begin to talk about what it's like to change a diaper on a 150-pound person. Real advice would help. Diets that really help to change the way older people are feeling, or eliminate waste. All of that. This is really down to earth stuff. Be relevant. Remind people of that impact. Remember at the beginning, I said, you have a story here that affects millions of people. That ought to be in every single story that you do. Don't dwell on the statistics, but how many people are going to turn in our country right now 80 in a certain year, or 95, whatever age that you want to impact on. Remind people how many are affected. Oral histories, remember, tell the story about the people. Every nursing home, every facility contains people who have amazing stories. People love to read biographies. John, you found that out. Why do we not learn the lesson? People will read about stories of people who are now in a nursing home, but remembering a different time, or can relate what happened to them before to what's happening to them now. Use social media, podcasts. I love that we're represented here. And segments of this should be all over Twitter, all over Threads, all over, name them all. I guess it isn't Twitter anymore. I left it with Elon Musk, but that's another story, another podcast. Avoid overpitching. Just going back to someone over and over again, especially a reporter who's busy and doesn't really want to do it anyway. That's not going to help you. You have to have a cool story. Find the lady with the goats and then go see them again. And one person told me, one PR person, very successful, said, if you can find a way to put Donald Trump into your story, you'll get a lot of coverage. And so on that kind of joking note, I'm going to end it and let the next person speak and maybe get some questions. Thank you.
Thanks, Rosemary. You reminded me, I was recently at a talk where the keynote speaker said, aging is cool, everyone's doing it. Anyway, I will now pass the mic over to John Leland and look forward to your remarks, John. John, you have to unmute.
Thank you. And Rosemary and Meg, those are really terrific presentations, and I learned a lot and got a lot of great ideas. I've got a notepad full of suggestions here for myself, notes to self. I was a reporter on the ground when COVID hit, and it was a time when we reporters were able to get long-term care stories on the front page. And given the reason for that, I'm not sure we want to get long-term care stories on the front page in quite the way we did in 2020. And I would remind people that it only lasted for a couple months. It was a very short period of time. But, you know, I thought it would be worth it for me, at least, and maybe hopefully for others on the broadcast, on this webinar, to remember how those stories worked out. And I look back at them, and they kind of fell into three and a half categories, the stories I was able to pitch. One was about just the vulnerability of our older adults, frail older adults, mostly older adults who are in long-term care. We know that the virus picked on it, got everybody sick, but it killed frailer older adults at rates far, far higher than anybody else. The second thing was the failures of the facilities themselves. Many ways in which they failed us, being understaffed, having poor infection protocols, even though they face airborne infections every year. The third was, I think, the resilience of older adults, including frail older adults, including frail older adults with disabilities in long-term care. And I said there were 3.5 categories, and I would say the half category is the heroism of the some of the people, a lot of the people who worked in long-term care, who were doing very, very difficult jobs for very little money. Something that connected all of these categories, which I think we maybe didn't write enough about, which is, I think, one of the great public health concerns of our day. It really is our attitudes towards the value of older age, particularly frail older age. And it's been something of an obsession for me, but how did it affect the vulnerability of older adults? A lot of the early coverage of the pandemic said, well, it's just older people who are dying. And it didn't look into the value of these years, including years that are spent not in great health. If we don't value that time, if we don't value an old age, then we tend to accept that a little bit more. How did it affect the failures of the nursing homes? If we don't value the age that are old, we don't value these late years, the lives of the people who are living in them, we accept the kind of understaffing and the poor infection protocols and some of the other problems. It was an experience unlike anything else I had reporting on skilled nursing homes during the pandemic. It was like looking at a black box, because we couldn't go into the facilities themselves. They were sealed off. The family members of the people in there couldn't go to the facilities. Often they told me they were having a hard time even getting anyone to answer the phone because the staffs were so overworked. The workers wouldn't talk to us because they often had very fragile work situations and they were afraid to talk. The family members, when they could talk to their older relatives, often wouldn't talk to us either because they feared retribution from the administration. And even the residents often didn't want to talk about problems in the home because they feared retribution. And a pretty highly placed person in that world said to me that it was like dealing with the mafia, dealing with an organized crime organization, because there was this code of omerta and nobody would speak out. So those are, and we think about the ways that that the understaffing and the underpaying of the individuals who work in these facilities contributed to the COVID pandemic. Facilities relied upon staff workers, and they also relied upon agency workers. Agency workers weren't hired by the facilities themselves. They worked for outside agencies, and they would often go from facility to facility. Some worked at 3, 4, 5 facilities, and they were perfect vectors for the virus itself. And my favorite category is the resilience of the older adults, including the resilience of the people in the facilities. These made for some of the most rewarding stories because they came as a surprise to people in ways that they shouldn't. Had they been reading me and so many of the other reporters out there who do a much better job than I do, stories about resilience somehow resonated with people because they seemed unusual. So how do we get more stories? It's a challenge, and Rosemary referred to this a little bit. A lot of it's writing about nursing homes and some of, like, say, the problems with nursing homes gets to be like writing about the problems with guardianship. I am pitched stories on guardianship, unhappy guardianships. My aunt, my uncle, my husband is being forced into guardianship against their will. And they're amazing stories. They're completely compelling. But once you've done a couple of those stories, you start to see that the story is always the same. And if you're an advocate, that sounds great to you. We need to tell this story over and over and over again because we need to keep telling it until it really sinks in and we have meaningful change. But for a journalist, that doesn't quite work. We don't want to be telling the same story again and again and again. And so it gets to be a challenge. So what are the stories that are different? And Rosemary got to this as well during her talk. She said, the stories that are different are the stories that are look at the differences in the people that are very, very human stories. People are leading interesting lives, including older adults, including frail older adults who aren't going out, who aren't doing some of the things that they once did in their lives. How are they getting by? And I found that those stories really do resonate with people. And one of the changes since Ron and I, at least, entered the journalism field is we can see what readers actually are drawn to. And a lot of them are actually drawn to these stories where we see the resilience in older folks. And also they're drawn to stories of individual heroism. So I don't want to be Pollyannish about this. You know, I mentioned before, my book is called Happiness is a Choice You Make. I never meant to imply that it's a choice we can always make, or if it's an appropriate reaction to everything. It means that happiness is something, if we're going to the extent that we're going to be happy, we have to create that happiness. But we can't only do stories about the upside. We do have to write stories that are the negative stories. They just have to be really, in some ways, differentiated from the other stories out there. And so it may be that we will do less volume with greater impact. And maybe one of the things that encourages me with podcasting and blogs is that there become many more media for people to get messages out, including ways for people who are advocates to get the messages out. So to the extent that people out there on this call are thinking about how they can get their messages out, I think that my greatest advice would be to try different media, often before an outlet like the New York Times, unless you have a very, very distinctive story of a unique individual. And even if you do have that, know that I get pitched stories that are completely compelling about amazing individuals, about that Holocaust survivor who's now doing this, and they're just amazing, and I just can't do them all. So, and even if I could, I couldn't pitch them all. So, thanks.
Sorry, I was muted. Thanks. Well, maybe you have another book here of all these fabulous people that you're meeting. And I think, to your point, it's about changing the attitude. And maybe if there are just more stories about people who are 90 and 100 or living in a nursing home, if that was more something that we read about every day, maybe the attitudes would change. Anyway, now our next speaker, Ron Rowell, will let us know his thoughts.
Okay. So this is the danger of going last. It's like, okay, everybody has said things. Now what do I say? But actually, I think I can add on to some of the very incisive remarks of the people before me. So I spent about 20 years as a writer, reporter, and editor. And then actually, surprisingly, now I've spent more time outside the news media afterward than I did as a reporter and editor. So I have an interesting vantage from both sides, and I thought I would just talk a little bit about sort of getting into the mind of the editors and the gatekeepers in the media as to what they choose to cover. And I think that one of the things we just have to be realistic about is that most of the news media, there are things called news pegs. So stuff is happening all the time. So the question that goes through an editor's mind and the people who put together papers or agendas every day for whatever their platform is like, okay, what are the stories of the day and why should I cover this? So I've done some of these sessions. I did one for the real estate industry years ago about what makes news. And so what are what I call news drivers? What are the things that people look for? And I put together 10 things. One is the importance, the impact of a story, the proximity, how local is it to your readers? What's the magnitude? How big are the numbers? The more people it affects, the more important the story. Prominence, are celebrities. Does this affect celebrities who could be, examples of stories? The unusualness of it. Yeah, how different is this? What makes it, you look at it twice? The old meme of dog bites man is not, but man bites dog, that's a story. Conflict, that's conflict always has a story. It drives it. It creates a drama. So it's a natural storyteller. Progress. Is there some advance of some kind, and especially in science, that needs to be covered? And human interest, as John pointed out, or that whether they're heroes, whether they're victims, especially victims, because I think there's a function of the press that looks at itself as the guardian of those who are vulnerable. So, are there victims? And is there change? What's different? Is there something really different that I need to pay attention to? So there's a certain, people complain about negative news all the time. And I sort of get that. It's easier to tell negative news because it usually comes out of conflict. But it also serves one of the functions of the media, which is it's an alert function. That's what they look for. That what should you pay attention to that may affect your life? So there is that. It's just a natural part of how the news media covers stuff. And it's difficult to cover things like long-term care, systemic change, because it's like, okay, well, how do I cover that from the perspective of a reporter or an editor? And I think what you have to do is you've got to figure out how to break these trends into discrete events. So things are happening. If there's a march, if there's a demonstration, that's how a lot of news coverage gets generated, by turning something into an event that can be covered. Is there a report? Is there a study that you can turn to, that you can then look at data, you can look at trends, and then say, okay, what editors look for is, okay, how can we humanize this data or this report? So then you look for stories of people who were affected by this trend. One of the things that intrigued me about John's coverage is that again, from an editor's perspective, so I recall, John, what happened was an editor came to you and said, "Hey, there's a report that says the fastest growing segment of our population are 85 and older people." Like, okay, and how do we humanize that story? How do we tell those stories? So it's can you take something? Can you take data? Can you take a report? Can you take a trend and humanize it with anecdotal stories that demonstrate, this trend? So I mean, you look for ways to turn large subjects into discrete events or reports that can be stories, and you have to sort of keep going and looking for different ways to approach it. As John pointed out, one of the things is like, you can't tell the same story over and over again. So, when there are big stories that you want to keep telling, a lot of editors look for, okay, how can we follow up the story with a different angle? So you look for different angles to this story, different aspects to the story of nursing homes. I think that, some of the things I guess Rosemary mentioned too are like, okay, so how can you advance the story? Well, are there innovative approaches to dealing with nursing homes, turning them in fact into homes? As Meg reported, there are some fantastic projects. In some cases, it's like, well, okay, who would write about that? Well, look for something in your area. Is there some innovative project in your area? So that turns it into a local story. And a lot of media these days, because there is such a proliferation of media and platforms, they are, focusing a lot on local, or as they say, hyper local. Even the weather forecast is hyper local weather forecasts. So if you can if you can localize a story for your area, and in many cases, you're getting out the message in a more effective way. I would, when people would come to me and they want to put a story into Newsday, and this was afterwards, they'd say, I want to get a story into Newsday, the Long Island paper. And I'd say, why? Why do you want to get a story into Newsday? Well, it's the big paper. And I said, well, going back to what you said, Rosemary, well, what's your message? What message do you want to get across? how do you get it across? In some cases, local papers you have greater access to them. You can, actually have more personal relationships with reporters and editors, and you can get the story out in ways that may be more effective than a bigger paper, because the bigger paper will have more competition for space. It may not get in at all. So, again, don't focus on, like getting in the big players. The big players will often pick up stories from the smaller players. Well, this is not about long-term care, but I mean, on Long Island, the big scandal over this Congressman George Santos, that story, the Times took the story and really drove it. But some of the initial reporting of it was done by a smaller local paper that mentioned some of these things. They did not have the resources that the Times did, and the Times really went with the story. They really broke the story. But there were lots of stories, and I found the same was true when I worked at Newsday too, that that bubbled up from smaller weekly publications. So pay attention to them as potential outlets to start getting the story out. Pay attention to these, how stories are covered by those news drivers, and recognize that the media industry is human too. So one of the jokes among reporters when I was a reporter was, news is what happens to editors. So, a little bit of a facetious, tweet, but not altogether untrue. I mean, and you have to look for spots and not get discouraged, because some things just take time to develop. And let me give you another example from another, not long-term care, but in the early 90s, I was covering workplace issues. And a lot of things I was covering at the time had dealt with, women in the workplace. It was family issues. And I had talked to some local women's groups who said, you know what, with women going back and really getting involved in work, we're starting to really experience, especially as women climb up the ladder, a lot of harassment stories. And I said, well, that's sort of interesting. This was a local story on Long Island. And so I went to my editors. I was a reporter at the time, and mentioned this, and they were like, yeah, maybe, I don't know. It's okay. We'll do like a 350-word story on it. Okay, just because it came out of a report. So I said, yeah, I've got a report to show this. It's got data in it. It's not just anecdotal. They said, okay. And that was it for the time being. And then what happened? I had done a lot of work, and I had a lot of resources that were looking at this issue. But then what happened? The Clarence Thomas hearings, and Anita Hill was testifying in Congress. And then all of a sudden, everybody wanted to know about sexual harassment in the workplace, and women were coming out everywhere to talk about this issue. So sometimes you just have to wait for the right time, be prepared with a trend story like long-term care and nursing homes to look for those moments when you can get it on the front page. And so, and again, front page is sort of a metaphor at this point, because that's the early days of my journalism. And when people, especially in tabloid journalism where I was involved, there was a front page. Like, what's on the front page? Because people at those days still sold stuff on the newsstand. That model has largely dissipated. That even when there is a front page, where I am at least, and most circulation of mass media is by subscription. It's not single copy sales. So you don't, even though there's this journalists worry about what they're going to put on the front page, think about what is the front page of different platforms, because they're the most appropriate way may be to get onto a podcast. It may be to get onto news show. Look for and it will vary depending upon the platform. So with podcasts in general, you are looking for compelling stories. In some cases, you're looking for influencers, people who get on the shows who are experts. Sometimes they come out with a book, so they want to promote a book. On television or cable media, you have to think about visual, like what are they going to show on the screen when they tell you stories? So does your story have a visual component? And that's important. And I got to be honest with you, in some cases, even in print media, what got on the front page was a visually compelling image. That's what made the front page, not just the story. If you had competing stories, but one had better images, that got the front page. So, so let me see. I'm coming. So the last thing I want to mention is don't get discouraged, folks. As I said, sometimes it's a matter of being prepared and being consistent with looking for different ways to get to a story. And long-term care is that kind of a subject. And it's not easy. As I think Rosemary mentioned, that one of the ironies is that a lot of these publications, the people who are actually reading the publications are older people, not younger people, and yet a lot of these publications are worried about the next generation of readers, when they should be just worried about what's the message, how do we get to people, period, whether it's online, in print, however we get to the audience. And it is hard because and I've written a fair amount about this. I'm on the I'm a member, excuse me, of the New York State Executive Council for AARP, and as part of that role, excuse me, I serve on one of the committees for the governor's master plan for aging. There are lots of different committees working on lots of different topics, but one of the underlying aspects of it is covering of ageism. It's a real thing, and it's changing slowly, and it will continue to change, in part because of demographics. There is a line, demographics is destiny. So people will start paying more attention to this as more people get involved in long-term care and are getting older and aging in different ways. But it's still there. It's still there. And I got a glimpse of this when I started this section of Newsday called Act Two. It was good, but it was just like perplexing. So I proposed doing the section for people 50 and older. And they said, why do you want to do this? Why do you think we should do this as a newspaper? And I said, well, because people are living longer lives. They have lots of issues as they get older. Some of them in long-term care, but it's financial, it's family, it's social. How do they lead, successful lives all the way through? I said, well, that's interesting. And so they said, okay. And then no, they didn't say anything. And then they came back to me and said, okay, we're starting a section called Act Two. I'm like, okay, that's good. And then they said, and we're going to put this editor in charge of it, not you. Said, okay, so we're putting someone else in charge who really has no interest in this, but okay. I picked it up later, and they asked me to do it. But the initial foray was to put it in the Saturday paper, the special section. And for those of you who know anything about newspapers, the Saturday paper is the paper that doesn't count your weekly circulation. So they were like, we don't know if this is going to work. It's going to be important. And the thing is, it became a fabulous success. The readers loved it. And there's a lot of interaction, a lot of engagement. And this was sort of pre-internet days too. So it just sort of proved, it was proof. And yet there's been resistance since I left there. It's been cut every year and put into a section in the back of the Sunday paper where people can see it. The Sunday paper does have, the biggest circulation, but it just shows me that we are still dealing with lots of issues of ageism and a lot of we still have a lot of work to do in terms of breaking through, and getting people to recognize how pervasive it is, and people don't want to cover it. They
Well, Ron, I'm going to have to just suddenly
stop.
in here.
Hard stop.
But because we have one more speaker, and to your point, Ron, you're making me feel that maybe we are sort of front page replacement right here. We're offering a platform, and we have a story that we're going to hear now. We've invited Rick Gamache, Chief Executive Officer of Aldersbridge Communities, a not-for-profit continuum of care for older adults across Rhode Island, to speak about some of the realities of running a nursing home in today's world. So Rick, would you like to take the floor?
Sure. Thank you very much, Michelle. And wonderful. The panelists, fantastic stuff. I've learned so much from all of you. When the Gray Panthers invited me, I wasn't quite sure how I fit in here, but I think I fit in because I may have a story for you. And it's catastrophic. And it's not just happening to me, it's happening across the country. And that is, a lot of nursing homes are closing. And I'm not talking about the bad ones. I'm talking about good ones. In Colorado, there were some rural nursing homes that closed, and the residents had to be moved 100 miles away where their family members could no longer get to them. This is happening across the country where independent owners of nursing homes are just closing or selling to the big for-profits because they can't afford to stay in business. And there are really two factors here, and they're part of the same issue. It's staffing and it's funding. And those things go together because more funding helps with the staffing issue. But staffing was a problem before COVID. It just got a lot worse during COVID, when a lot of people retired early, quit, said, I can't do this. A lot of people burned out. And I think that for me, as I'm listening to everyone, I'm realizing that at some point in the next few days, I need to walk through that door down the hall and tell a 104-year-old resident that we're closing and she has to move. I have 74 residents that we're going to run out of money in February, and 175 staff members that I'm going to have to lay off. And this is because we're a not-for-profit. We've been around for over 50 years. We truly care for people with low income, 82% Medicaid. We have assisted livings and outpatient rehab in the nursing home, but the losses the nursing home is incurring, actually averaging $190,000 loss per month. And that's because over COVID, our costs increased by 35%, and our reimbursement from Medicaid increased by 8%. So the gap, there was always a little bit of a gap, but now it's so wide that we can't survive. And I was thinking about how the folks in our continuum have gone through, spent down maybe of what little funds they have, and they're in the nursing home. And some of the big for-profit assisted livings, when people run out of money, they discharge them to us. They discharge them. Now, we've never discharged anyone because they ran out of money, but those for-profit assisted livings, they're not on the verge of going out of business. And I am. It's like, what do they say? No good deed goes unpunished, right? We're trying to do the right thing. We've been trying to do the right thing for 50 years. We're going to go out of business. I've been working in nursing homes for 42 years. 42 years. This is a horrible situation. And so it's rural nursing homes, independent nursing homes, and certainly not-for-profits. You have almost 400 not-for-profits have closed across the United States because of lack of staffing and lack of funding. So my residents here know, I've been talking to them about our financial troubles. And how did they react? They held a bake sale last week. My residents held a bake sale They made banana bread in their rooms and in a microwave. I mean, this is heartbreaking. It's heartbreaking. And this is not just happening to me in Providence. This is happening over and over. Massachusetts has had 20 buildings close. Iowa has had 28 buildings closed. This is happening all over. And when a place closes and residents need to be moved out, this is catastrophic. It's horrible. And we need to do something about it. So I think that my presence here is to maybe say there is a story and there is a time, and the time is now. It's right now for these stories to be out there. And, you know, I hear a lot about how we need to reform nursing homes, and I've been in the front of reforming nursing homes for my whole career. I'm proud to be part of the Live Oak project that Meg mentioned. I'm proud to be a member of Moving Forward with Alice Bonner, who I know is going to speak on one of these. I've been reforming for a long time, but I want to set the record straight here. When we talk about bad infection control practices, let me tell you what it's like to work in a nursing home where people share bedrooms and share bathrooms with the room next door. Okay, and in some states you have 4 people in each room, 8 people sharing a bathroom. Now, think this is the worst environment for infection control, but this is the way nursing homes were built. Most of our buildings were built in the 1970s. We opened in the 70s. And this is the way it is. The shower is down the hall as if you're a college freshman. That's how you have to live. This is wrong. And we've been trying to convert each room to a private room as we go along, with a private shower inside each room. But we're out of money now. It's over. It's over. We're going to close. So again, I'm going to stop talking because I know there are people with questions, and I just want to say that this is my story. It is catastrophic, and the time is now. It's also the story of a lot of other colleagues of mine across the country. And nursing home owners are not all bad. Nursing home operators are not all bad. And as I think John said, the frontline caregivers, they're heroes. What they went through, they're heroes, and they deserve to be treated as such. Thank you for allowing me to speak.
Thank you, Rick.
Rick. I hope we can get some press out of the group here. A lot of people have been writing in the chat about the civil rights of residents that were violated and being in lockdown. I don't know, does anyone want to address that issue? We're almost out of time. Is there anybody? Oh, Rick, you would like to answer?
Yeah, I just want to remind everyone that it was not the nursing home's choice to keep family members out. It was our Department of Health in each state that prohibited visitation. It was a bad policy. You know, I know that there were lots of problems with it. And I know that people like Carrie, like Charlie Galligan, and some others here were very much a part of the Essential Caregivers Act across the country and locally. And it was a bad policy, but don't blame us. This is what was handed to us.
This is Rosemary. I like that story idea, but I would divorce it from COVID. That sounds like partisan debate, you know, whether you have to wear a mask or get a shot. That's violating your civil rights. But losing civil rights as you get older and others are making decisions for you, when's the right time for that to actually happen and when not, what decisions you get to make when you're in a nursing home or other types of facilities, that's got possibilities as a theme for several stories.
Somebody in the Dr. Ali says, I work in a newsroom as a
I actually,
oops.
Thank you so much for inviting me. I actually worked in the newsroom at ABC News as part of the medical unit when this first started. I knew from my colleagues in Italy in February and January even before that this was going to hit long-term care hard. So I actually interviewed AMDA president way before it even hit our shores. And, you know, it is a challenge, but now I have to say a lot of the speakers said a very good thing. If you use, you know, I'm looking at the stories that come, the studies that come out on embargo. So a lot of studies regarding older adults and a lot of health services research with long-term care. So I think there still is a lot of good stories out there, but you know, you have to have that human element in the whole bake sale thing. I mean, that could, I feel like pitching it to the person at 60 Minutes. So it does depend on who you know, and you establish a relationship with a booking producer, and that's how you can get the word across. Media is so powerful. It's the only way we're going to change society's view on older adults, for sure.
Thank you for that. Is there anyone else? I'm trying to, I'm scrolling through here.
Sandra Moore keeps raising her hand and you haven't seen
Oh,
her.
sorry,
Michelle.
I can't see everything. Okay, Sandra, where are you? Oops.
Unmute Sandra.
There we go. Hi, can you hear me?
Yes.
Yeah, I'm a physician, not a reporter, and some of the things that are being discussed are fascinating, but they're not my bailiwick. I do see, however, and this is more personal, what I've seen with family members and friends, people who have completely lost their civil rights, sometimes almost overnight. Typical story is they have an untoward event. Maybe they have a breakdown, okay, and they wind up in a mental ward briefly, or they break their hip. That's a big one. By the time they're getting ready to go home, their family may have moved in and taken them out of where they were living before. And I've seen this happen more than once. And it's usually done under the rationalization that there's dementia, and of course, bad dementia, right? And so to help them, we're going to put them in a nursing facility of some sort or another. And all civil rights are lost. And these are often people who are highly functional before they had their fall, the fall that ends it all. This is not only something that we see happen to loved ones and neighbors and so on, or often it happens to neighbors, but you just see them being wheeled out of their house and then somebody else buys their house, right? But we also worry about it happening to us once we see it up close more than once. We realize this could happen. This really happens to people. They completely lose their civil rights. And nursing facilities are often set up with nurses having some attitudes about overriding the patient in terms of civil rights, whether you have to take that pill if you don't want to, if in fact you're cognizant, you can think and you can talk and make decisions, but you have to take that pill. And I think that we need to address this as a country and address our attitudes about older people. And you can call it cognitive decline. We have all these cute words for it now. But the truth is that things happen to the mind as we get older. They happen to our minds when we went through adolescence. They happen to our minds when we went through our 50s. It just changes. Every decade has a different kind of mindset and ways in which we deal with language and ways in which we file and store information. And then all of a sudden, when we reach a certain age, it raises eyebrows and it has to be laughed about. I tell you, when they laugh about it on Saturday Night Live, which is a show I really enjoy, I want to complain and say, what are you doing? What are you doing making fun of older people? You wouldn't do that with blacks. You're too smart to do that with blacks. You're too smart to do that now with women. You might not even do that with gays, but you're doing it with older people all the time. You find it very funny. There are little frailties and problems. And I think there needs to be responsive. I think, I don't know how to join Gray Panthers, how to be part of it. I was looking to do that. That's why I found this on the web. But there needs to be a response to every time older people are besmirched in the media. in the same way that that would happen with Jewish people and gays and so on. People would respond and come back in force. We don't have a voice that's doing that for us. In fact, we laugh along sometimes. And part of it is that it's not going to be us. It's not going to be us who gets older. We won't get old. They're old. They're the old people. It won't be us. It won't happen to us.
Well, going back to John's point, it's about attitude, I guess, the attitude toward older adults and valuing our older years. So I would just want to thank everybody because we are out of time now. And we will reconvene next month on November 28th when the Moving Forward Coalition will be speaking about the action plans that they have developed for nursing home transformation. And in the meantime, I also want to thank Rick for everything that you've said, and hopefully maybe we can mobilize here to try to help you in some way. And thank you to everybody who attended today. So I wish we had a more positive ending, but I guess mobilizing and uniting and working against ageism and for nursing home transformation is what we're all trying to do together.
Thank you.
Thank you.
Thank you, Rick, also. Thank you.
Thank you, Michelle.
Thank you very much. This was so interesting.